What's going on, guys? Welcome to week number 12 of TPI Tuesday. I'm Matt Santoro. I'm a doctor of physical therapy as well as a TPI certified medical practitioner. And today on week 12 of TPI Tuesday, we're going to be talking about the knees. Let's get started with our anatomy. There are three bones that we're going to be talking about today. We have our femur, which is the thigh bone right here. We have the tibia, which is one of the two lower leg bones. Those connect right at the knee joint. We're also going to be talking about the patella, or the kneecap, and that patella helps to connect the quadricep muscle down to the tibia and helps to interact as a spacer in between the quadricep tendon or the patellar tendon. So along with the quadriceps, we have another couple muscles that we're going to be talking about today. We have the hamstring muscles, which help to flex the knee or take the knee from an extended position straight out and bend backwards to get our heel towards our backside. We also have some other muscles, things like the popliteus muscle, the sartorius muscle, or the gracilis, and those are just some accessory muscles that help the knee move in different directions. Now, the knee is a very stable joint. We have two main directions that it can move in. We have our knee extension and our knee flexion, which we've already talked about. In addition to those two, though, we also have rotation that happens at the knee. And this rotation is very subtle, especially compared to joints like the hip or the thoracic spine. But the knee is able to rotate a bit externally, bringing the toes from straight in front of us out to the outside or away from the body, as well as internally and medially, taking the toes from straight ahead and rotating them so that they point towards midline. And this action is going to be very important for the golf swing as well as in life. Now, in the TPI screen, there's no test specifically for the knees, but we're going to see the knees working in a few different tests. We're going to see them work in the overhead deep squat test, the lower quarter rotation test, and the bridge with leg extension test. And while they're not looking specifically at the knees, proper knee mobility and proper knee function is essential to someone passing those tests. In the golf swing, the knees are going to be very important for helping to stabilize the lower body as the upper body turns in the backswing and in the downswing. Additionally, the knees are important to rotate, just as we talked about. They help to get a little bit more distance in those rotations, which help us increase club head speed for better distance, better speed, and also helping with accuracy. In life, the knees are going to be important for things like walking, things like getting up out of a chair or up and down stairs. Some inadequacies that we can see in the golf swing as a result of poor knee mobility or stability. We things like swaying and sliding, moving away from the target line and toward the target line in the backswing and in the downswing respectively, as well as a loss of posture. In life, some things that we can see as a result of poor knee mobility and stability will be things like difficulty walking or pain with walking, difficulty getting up out of a chair or getting into a chair, or even up and down stairs. So don't go anywhere. We're going to talk about some fixes. I'll see you guys soon. Alright, what's going on, guys? Welcome to the fixes component for the knee video. Now today, for our knee fix, we're going to be talking about squats. A lot of people might be thinking, well, I've heard that squats are bad for the knees. Why would we do them? And actually, that's not very true. The studies that came out that said that squats were bad for the knees weren't based on very good science. As a matter of fact, all of the patients that I have coming in with knee pain, a knee replacement, or after a knee surgery, all do squats. It's an excellent exercise as long as it's done properly. So the things that we want to think about for doing a good squat would be, one, to keep our spine straight. It doesn't necessarily have to be completely vertical, but making sure that we maintain a neutral spine the entire way through is very important. The next thing, we want to make sure that our weight shifts backward onto the heels. Now, with that said, it doesn't mean that our toes are going to start to peel up off of the ground, but we should feel the weight shift back a little bit, maintaining contact with the whole foot the entire time. The next thing that we're going to want to think about is to keep the knees behind the toes. Now, if we keep the knees behind the toes, that's going to limit the pressure that the kneecap puts in between the femur and the tibia. The further forward we bring our knees, the more pain that these squats can generate. And lastly, we want to make sure that our heels and our toes are even, and they're not pointed in, they're not pointed out. So today I'm going to use our TRX trainer, this is a suspension trainer, to give me a little bit of help doing these squats. Now obviously not everyone at home has a TRX trainer or suspension trainer. So what you can do instead is grab a high back chair out of your dining room, place that in front of you and use it for support. So let's get started. I'm going to grab the TRX trainer, make sure that my feet are even, my heels and my toes are same distance apart. Keep my spine straight, shift the weight back onto my heels as I lower down, get to parallel, and then come on back up. Let's do that again. I'm going to shift back, lower down, and come on back up. Now, we have 3 options for you guys to check to make sure that you've hit all of those points. The first one is you could borrow someone, ask them to watch your form, and have them critique you. The second option is that you can grab a mirror, place that either in front of you or to the side of you, depending on which of the aspects you want to be looking at, and have that be the judge of whether or not you're keeping those toes straight or you're keeping your spine straight, things like that. The third option, I think this is the best option, is to grab your cell phone and record yourself doing these squats. What that's going to do is it's going to allow you to play back the video and see which of the components that you need a little bit more assistance on. Additionally, over time, you're going to be able to see how those squats are improving. So from starting today to 3 months from now, you're going to see just how much better your squats have gotten. So as always, if you have any questions, any comments, feel free to leave them in the box down below. We'll get back to you as soon as we can. Or you could just give us a call. Our phone number is 732-720-2566. I'll see you guys next week on TPI Tuesday.